and the possibility of a previous pregnancy.
Team 12's William Pitts continues our team coverage. He's been poring over those documents today. And Will, what did you find?
Well, there's a lot of medical terminology in these documents, and we wanted to make sure that we understood it and the notice of claim portrayed it correctly. So we took those medical records for a second opinion. There are three allegations we wanted to specifically look at. First, can a doctor really tell if a woman's been pregnant before just by examining? Dr. Andrew Carroll looked at everything included in the notice of claim, including medical records. He has not examined the victim.
I think that the words that they're using are probably incorrect.
Dr. Carroll says what doctors are looking for is scarring, but that scarring doesn't always mean a baby was delivered.
If you're looking at a perineal scar, you could also think that there may have been trauma due to a forcible rape that produced a laceration.
Phoenix police issued a statement saying they don't think there was a previous pregnancy either, based on a separate review. Next, in the April physical exam, there was no pelvic exam done. The paperwork says it wasn't needed.
There may not be a reason because you don't suspect sexual activity, which is what puts most women at risk for any pelvic abnormalities.
And Dr. Carroll says that may be the problem. He believes the staff may never have considered pregnancy because they didn't think it could happen. Which brings us to the third issue, the patient's medical care. Her doctor ordered laxatives, thinking she had constipation problems, and tried to get her to lose weight.
This would not have been normal process if we knew a mom was in her third trimester.
And Dr. Carroll noticed two more warning signs in the medical records. First, the same responses to questions apparently copied and pasted.
That's concerning. That means that what's being done is a template is being applied to the note rather than an actual note being written, each time distinct to what the exam was.
And second, Dr. Carroll says the woman's physical exam should have triggered a warning.
A woman in her third trimester who has elevated liver function tests like this woman did, along with lower extremity swelling, those are signs of preeclampsia. And again, if you don't know the woman's pregnant, maybe you don't think it. But preeclampsia is potentially dangerous.
And Dr. Carroll doesn't give the staff a pass for not considering a pregnancy either. He says doctors are trained to think of everything because patients rarely tell the doctors the whole truth. In this case, we know the patient couldn't speak for herself at all. Guys, back to you.
All right, Will, as you can imagine, we've